It's easy for me to say I wouldn't be in Dallas if it hadn't been for the Cain funds to support my research in transverse myelitis. This is a rare disease where the immune system goes into the spinal cord and causes damage, and patients who have myelitis can go from normal to paralyzed in a matter of hours. The Cain funds, they allowed me to do several different things simultaneously. First was to set up what was at that time the second center in the world for transverse myelitis. And through that center, I've been able to provide care to patients not just from Dallas or North Texas or the region, but frankly from around the world. We've been steadily training fellows, neurologists who wanted to get expanded education in rare autoimmune disorders of the brain and spinal cord, and they've gone on to start their own programs around the country. And our research has really led to novel insights about the different causes, manifestations, and end results of myelitis. And it's enabled us to better understand what's causing the problem for our patients and then ultimately design better treatments for their condition.
I'm a fighter. I'm not going to stop fighting. In June 2016, I lost my vision in my left eye. And from there, my muscles just started getting weaker and weaker. I couldn't feel anything from like my chest and down here. I couldn't control like my bladder or my bowel function. It was just really scary. The doctors I was seeing before I came to UT Southwestern ended up diagnosing me with MS. Somebody told my mom that there was a good MS clinic out at UT Southwestern, and that's when they told me I had NMO.
It's not uncommon for our neuromyelitis optica patients to be misdiagnosed with multiple sclerosis. Not only do the therapies that work for MS not work for NMO, some of them can actually make NMO worse.
The misdiagnosis from the doctors before I came to UT Southwestern is basically what saved my life, because if I was still getting the treatment that they were giving me, I don't know where I would be right now. They helped me get my life back.
During this time, one of the most profound experiences I've had has been the partnerships I formed with patients and families who frankly have taught me more about this condition than I've taught them.
Doctors told me about a week into being in the hospital that AFM was most likely what was happening. I was sitting there wondering how I was going to finish my senior year of high school, how I was going to graduate. From that point on is when Dr. Greenberg got involved and took over my recovery.
After suffering such a horrific event and being left with profound weakness, we are seeing children improve slowly over time, but with tremendous commitment to physical therapy and rehabilitation.
My ultimate goal when I realized that I had the possibility of walking was that I wanted to walk across my graduation stage.
Sarah, so proud of you.
It was an incredibly special and just amazing moment that I don't ever take for granted, just because I know that we worked so hard to get there. I feel really incredibly lucky to have been able to have a lot of my care at UT Southwestern. Dr. Greenberg just knew so much, even when others didn't know anything about it.
When I moved to Dallas, we established the first dedicated pediatric center for these rare autoimmune conditions of the brain and spinal cord. And now, having been here 14 years, I've had patients who I literally saw in elementary school age graduate high school and college. And it's been an incredibly fulfilling position to have. Talking about my gratitude for the incredible philanthropic gift that the Cain Foundation made it possible for me to move here to Dallas is easy. I would not be here today, physically or professionally, if it hadn't been for that support. The very generous gift that was provided to support my work back in 2009 allowed me to do a lot of things aggressively and quickly in the first 3 years of being here on campus. Being able to hit the ground running and form a multidisciplinary program when there was none within the first year is unheard of. It was really that funding that made not just a huge difference for us in the beginning, but we're still bearing the fruit from that seedling as we sit here today. So I'm incredibly grateful to the foundation, to the university for everything they've done to support us in our work and ultimately provide care to the patients we serve.